Hello, and welcome to the online training module on positive youth development for siblings in foster care. This training is a collaborative effort between the Center for Advanced Studies in Child Welfare and the School of Social Work at the University of Minnesota. This training module is part of an online training effort that covers a wide range of topic areas in child welfare. Throughout this training, you will learn about risk, resilience, and positive youth development, Camp to Belong, a brief camp-based reunification program for siblings separated by foster care, and how positive youth development can support youth in foster care. This training will contain 3 modules. In Module 1, we will discuss risks to youth in foster care, positive youth development programming, resilience in the context of foster care, and the ways in which positive youth development and resilience can affect youth in care. Many risks are associated with the separation of siblings in foster care. Marianne Herrick and Wendy Pickus have studied the consequences of sibling separation, and they find that youth recall their entry into care as marked by grief, worry, guilt, and lost identity. Studies have shown that many children believe they have lost a part of themselves when they are separated from siblings. Children who experience abuse before their entry into care and leave siblings behind with their biological family often feel a considerable amount of guilt and distress. Some children may grieve the loss of a caregiving role that they had assumed with siblings before separation. Other children interpret separation as a deserved punishment and feel responsible for the separation. Separation from family can leave children without any knowledge of their cultural, ethnic, linguistic, personal, and family histories, which can cause challenges to youth cultivating self-esteem and sense of identity. A study by Maureen Smith found that children placed with siblings in foster care fared better than children who were separated from their siblings. The separated children presented with more externalizing behavior in the form of aggression, as well as higher rates of internalized behavior expressed as depression. Recent studies suggest that sibling separation minimizes adaptation to foster placement and reduces placement stability. Researcher Sonia Leathers found that adolescents who were separated from siblings in foster placement were at greater risk for placement disruption than those who were placed with a consistent number of siblings. Likewise, separated youth reported a weaker sense of integration in the foster home and were less likely to exit to adoption or subsidized guardianship than youth with consistent joint sibling placements. To promote better outcomes for youth, prevention science has called for expanding programs beyond a single problem behavior focus and for considering program effects on a range of positive and problem behaviors. Research suggests that the same risk and protective factors that predict problem behavior also predict positive outcomes. Positive youth development is one approach to reach more positive outcomes. The Interagency Working Group on Youth Programs defines positive youth development as an intentional, pro-social approach that engages youth within their communities, schools, organizations, peer groups, and families in a manner that is productive and constructive. Positive youth development is a strengths-based approach which builds assets like interpersonal skills, high-order thinking, self-control, and recognizing emotions. The model emphasizes the agency of youth, allowing them opportunities to develop a positive sense of self, perseverance, and the ability to plan for the future. Positive youth development relies upon the contribution and engagement of the youth involved. In order to be effective, positive youth development requires an enabling environment which provides safety, pro-social norms, value and recognition, youth and gender-friendly policies, and youth-responsive services. This approach provides opportunities, fosters positive relationships, and furnishes the support needed to build on the leadership skills of young people. Positive youth development falls under developmentally appropriate practices, which emphasize three primary principles when working with adolescents. First, the strategies promote physical, social, emotional, and cognitive development through interactions. Second, program expectations, content, and delivery are adjusted to fit the youth's personal needs versus conforming to rules and demands of the program. Lastly, developmentally appropriate practice takes a contextual ecological approach. Social and cultural contexts are integrated into the developmental opportunities offered by the program to ensure that they are relevant, meaningful, and respectful to the youth and their families. Positive youth development emphasizes pro-social development and life course theory in promoting health and well-being and the reduction of risk behaviors. Different strategies work for different age groups. Programs and services need to match cognitive developmental stage, for example, emphasizing immediate and concrete consequences, so pointing out that smoking causes bad breath may be more effective with some age groups than saying it causes lung cancer. Cautions should be taken when applying adolescent research to youth work. Developmental outcomes by age group are based on quote-unquote typical development and do not account for variance in developmental stage. The overlapping and bidirectional nature of biology, cognitive, and social development makes determining directionality of effects difficult. Timing of biological, cognitive, and social development do not occur at the same time. Developmental stages highlight differences across biological, social, and cognitive dimensions and should inform the design, implementation, and evaluation of positive youth development programs. Specific intervention approaches will vary according to developmental stage of the population served. Resilience is an abstract concept that we can all recognize perhaps when we see it, but have a hard time pinpointing an exact definition. Some complicating factors relating to resilience is that some people define it differently than others. Some see resilience as binary, you either have it or you don't, while most others in the field see it as a spectrum. Likewise, some individuals present as resilient in certain times of their life or a certain area of their life, but not resilient in a later time or a different context. Some argue that the presence of disorders such as post-traumatic stress disorder preclude someone from being resilient, while others disagree. The academic literature surrounding resilience does concede that certain components are present in a resilient individual. Resilience is an adaptation in the face of adversity, trauma, tragedy, threats, or stress. Different disciplines or researchers view it as a trait, process, or an outcome. Research suggests that resilience has a biological component. Stress can manifest in psychological or physiological symptoms or both. Failure of homeostatic mechanisms to end the stress response can result in these symptoms, termed the allostatic load. Cumulative effects of an overactive stress response in the body can result in health risks. Likewise, studies are pointing to certain genetic factors that contribute to resilience. A gene has been identified which affects amygdala activity in the brain to fear-inducing stimuli, accounting for 20% of variance for individuals with a certain genetic marker. Temperament is also closely tied to resilience. In one study, kids with the most internalizing and externalizing behavioral problems had the most difficult temperaments and were raised in high-conflict family environments. Protective factors that have been identified are sociability, intelligence, social competence, internal locus of control, warmth and closeness of affectional ties, strong family network, social support, and certain characteristics of school, work, and church. Environmental factors are important to consider as well. Resilience can be impacted by trauma severity, lack of social support structure, housing or food instability, and additional life stresses. Ann Maston is one of the leaders in the field of research around resilience and youth at the University of Minnesota. In 2014, she stated, "Currently, my favorite definition is that resilience refers to the capacity of a dynamic system to adapt successfully to disturbances that threaten the viability, the function, or the development of that system." In this quote, she acknowledges that resilience can be seen not just as an individual's trait, but as the capacity of a system. Youth within the foster care system are at an increased risk of multiple negative developmental outcomes discussed earlier. Positive youth development may address multiple risk factors simultaneously, which means that it may be an effective, low-cost strategy to address maltreatment and foster care-related risks. Now take 5 to 10 minutes to consider and answer the following questions. How do you consider resilience in your day-to-day practice? What interventions are you currently using to promote resilience and positive youth development? In Module 2, we will provide a description of the Camp to Belong program, including background, mission, philosophy, theory, signature events, and current research evidence. Sibling relationships are among the most important family relationships because they span the life cycle. Sibling relationships provide opportunity for pro-social development and learning. As discussed in the previous module, mental and behavioral health problems are associated with sibling separation, and separation leads to less stable placement and permanency outcomes. The mission of Camp to Belong is to provide brief, camp-based reunification to siblings who are separated by foster care. Camp to Belong seeks to promote and strengthen sibling relationships, foster resilience and self-advocacy, provide opportunities to create lasting memories, normalize feelings and experiences associated with placement into substitute care, and build a sense of community among participants. As discussed in the previous module, sibling separation can be harmful to children's well-being. Strengthening the sibling relationship through positive youth development might be a viable approach to mitigating the risks associated with separation. Camp to Belong's brief camp-based reunification program may be an effective intervention for sibling groups separated by foster care. During camp participation, youth are placed into family groups for daytime activities. These groups include siblings from the same family, as well as camp counselors who facilitate daytime programming for the family group over the course of the week. A total of 8 to 12 youth may constitute a family group. The total number of sibling groups in each family group varies according to the size of the sibling groups who participate. Individual camps are typically comprised of 5 to 7 family groups. Family groups spend each day together and rotate through the camp's day programming as a unit. Programming includes typical camp activities such as swimming, boating, archery, challenge courses, sing-alongs, and meals. During the evening, youth are placed into cabin groups. These groups are arranged according to sibling group membership and youth gender. In instances where sibling members are of the opposite gender, they are assigned to a cabin group that corresponds with their gender. Youth in cabin groups are typically assigned different counselors than the ones they are assigned for their family group. The total number of youth in each cabin group is dependent upon the layout of the individual camp's facilities, the number of available beds within each cabin, and the size of the sibling group. Cabins are decorated according to a theme developed by the counselors prior to the youth arriving at camp. Cabin group counselors help facilitate routine activities, for example, waking, preparing for the day, preparing for bed, as well as maintaining order and safety within the cabin during the evening and during breaks in the day's programming activities. Cabin counselors help manage common issues such as homesickness, anxiety, hyperactivity, and bedwetting. Cabin counselors also spend time processing the day's events with the youth by asking questions like, "What was your favorite activity? What went well today? What are you looking forward to tomorrow?" Evening processing provides a way to settle the youth at the end of the day, and it provides a safe space to decompress and talk about any issues that may have arisen between sibling groups or other members of camp that day. The recommended ratio for family groups is 1 counselor for every 2 youth, with a maximum ratio of no more than 3 youth per counselor. There are no fewer than 2 counselors per cabin group, and the ratio of campers to counselors follows the organization's maximum ratio of no fewer than 1 counselor for every 3 youth. Programming is facilitated by camp directors along with volunteer counselors, some of whom were former foster youth in foster care. Prior to selection into the program, camp counselors undergo child abuse and criminal background checks and detail their motivations for volunteering in their application materials. First-time counselors are interviewed by camp program directors prior to their selection for participation. Counselors are not required to hold certain educational degrees or certifications in order to volunteer their time with the program. Counselor training is an intensive 3-day process. During training, counselors learn about the typical emotional and behavioral issues children may present with at camp, mandatory reporting and incident reporting procedures, social media policy, maintaining appropriate boundaries, medication adherence and first aid, policies surrounding physical touch, emergency procedures, and a detailed overview of the camp's week-long programming activities and signature events. Counselors engage in extensive team-building activities to foster a collaborative, compassionate, and communicative environment prior to arrival of the campers. Counselors learn techniques to develop rapport and relationship with the youth, express compassion and understanding for their experiences, as well as strategies to handle youth behavior issues. Counselors are introduced to behavior management techniques, including collaborative teaming, active listening, rolling with resistance, positive reinforcement, providing alternatives, giving space, developing expectations, identifying non-negotiables, and setting boundaries. The overarching role of the camp counselor is to provide a safe, comfortable camp environment for the youth so that they can spend quality time with their siblings. Along with typical camp activities, Camp to Belong includes 8 signature events designed specifically to strengthen the sibling relationship and create lasting memories. The opening campfire is the first time that all participants come together. This activity sets the tone and theme for the week and orients participants to the purpose of camp. Along with the camp director and camp leadership, veteran campers and former participants, now acting as counselors, speak to the youth about the purpose of camp and what to expect over the course of the week. The birthday celebration is an all-camp activity designed to provide separated siblings with an opportunity to create memories related to celebrating birthdays. Siblings who are separated by foster care often miss this important developmental experience, And the camp program provides sibling groups with opportunities to exchange gifts, share cake, and celebrate one another. Gifts are donated over the course of the year, and during one of the week's daily rotations, each youth is allotted time to select and wrap a gift for one of their siblings. Campers will create a personal birthday card in which they can share positive messages about their sibling and their relationship. During the all-camp birthday celebration, youth share the gifts that they selected and personal cards with other members of their sibling group. One of the signature events in the weekly rotation involves campers making and sharing pillows and quilts with another member of their sibling group. Campers select the design of the material used to make the pillows and quilts and write personal messages to their siblings on the fabric. Program staff may assist the youth by sewing the pillows and quilts once they have selected the materials and written their personal message. On the final night of camp, youth are invited to share their personalized pillows and quilts with their sibling and are given the opportunity to share the message they wrote to their sibling with the entire camp. The youth return to their separate homes with the personalized pillows and quilts bearing the messages written by their sibling. The Life Seminar activity varies according to each camp's resources. Life Seminar is divided according to age and gender. Younger children of both genders attend one life seminar, while older females and older males attend separate life seminars. The Life Seminar focuses on fostering resilience for its participants, particularly as it relates to placement into foster care and separation from siblings. Participants learn about self-advocacy within the foster care system, developing and maintaining healthy family relationships, and making good choices. Inspiration Night is a time for youth to share stories with the larger group about what inspires them to stay connected to their siblings. This signature activity is a chance for campers to talk publicly about their siblings, their feelings and affections, memories of living together prior to separation, experiences being separated, and their hopes and desires for the future of their sibling relationships. Camp directors closely facilitate this activity to ensure that it remains an appropriate and positive experience for the participants. Some camp locations will invite guest speakers, usually former youth in foster care, to this event to share their stories and inspire the youth to foster meaningful bonds and connections to their siblings. The carnival event is designed for fun. Camps typically hire an outside contractor to provide carnival resources such as inflatables, games, and carnival food. The carnival event is supervised by camp counselors, but sibling groups are free to participate in the carnival events in an unstructured way. Throughout the week, a professional photographer takes photos of the sibling groups as they participate in camp program activities. At the end of the week, these photos are printed and made available for the youth to create scrapbooks. After completing the scrapbooks, youth are provided the opportunity to have other participants sign their scrapbook with a personal message. Participants return home with their scrapbook bearing messages and photographs of their experience in the camp program. The closing campfire occurs on the final full night of camp. This event is designed for the participants to share what the week has meant to them and their plans for maintaining the sibling relationship following the close of camp. All youth participants are provided the opportunity to speak, including camp counselors, staff, and camp directors. This event signals the close of the week, and campers are prepared to return home the next day. In order to determine the impact of Camp to Belong, researchers have engaged in a multi-year observational study with a pre-test, post-test survey design. The pre-test is administered to youth upon their arrival at camp, and the post-test is administered on the final full day of camp. This evaluation focused on examining changes in youth ratings of sibling support and conflict between initiation of camp and again at the conclusion of camp. This evaluation sought to determine if changes in youth reported outcomes could be attributed to the age of the responding youth and the number of prior experiences that youth have had with the Camp to Belong program. The survey measures sibling support through a 7-item measure with an alpha level of 0.82, and it measures sibling conflict with a 2-item measure that has an alpha level of 0.71. Research findings suggest that camp participation may reduce sibling conflict. Also, improvements in sibling support are noted for youth who have attended camp in the past and have prior exposure to camp's programming. Further research into the Camp to Belong program suggests that sibling warmth is positively associated with resilience. Wojak, McWay, and Waid produced a cross-sectional look with the data from 2013. The questions for sibling warmth were generated by the Camp to Belong Evaluation Committee and were influenced by the questions on the Sibling Relationship Questionnaire. Sibling warmth was comprised of 6 items on the survey. Interestingly, sibling warmth was not significantly associated with gender, developmental period, or the number of times that the youth had attended Camp to Belong. For youth in middle childhood, however, the combination of being male and having low sibling warmth was associated with lower resilience. In the third and final module, we will discuss how knowledge of resilience and positive youth development programs like Camp to Belong can guide the practice of social workers in the field. Sibling relationships are protective for youth who have been removed from primary caregivers. Sibling warmth and support can promote resilience for youth in care. We have seen this in the academic literature discussed in Module 1, as well as the research resulting from the evaluation of the Camp to Belong program discussed in Module 2. Positive youth development diverges from traditional intervention approaches, providing a fun and normative opportunity for youth development. Camp to Belong seems effective in reducing conflict and increasing support and resilience among youth separated from their siblings. Positive youth development is a novel intervention format for youth who otherwise receive problem-focused interventions. Child welfare systems should consider positive youth development as an approach to strengthening protection and building assets with youth in care. Now take another 5 to 10 minutes to consider the following questions. What kinds of activities and programs are available to your community to promote positive youth development? How could these programs benefit youth in foster care? What can you do to promote positive youth development in your agency?